Well, for more on what came out of the briefing with the Acting Health Minister, Mmaloko Kubayi-Ngubeni, let's go to our reporter Heidi Jacos, who's been tracking it for us. Heidi, thanks for standing by there. The main takeaways for me really were the registration of the over 50s. When does that start?
Yes, indeed, Annika. We do understand that those that are 50 and above can register as of the 1st of July, but they'll only be able to get their vaccine as of the 15th of July. So there's about a 2-week gap that we are trying to get clarity from the Acting Minister of Health as to why there needs to be a 2-week gap for those to actually get their vaccine. It's very good news because this means they are opening up the different phases. Phases are going to run concurrently. And we did hear from the Deputy Health Minister, Dr. Joe Patla, who indicated that even though they're opening up sectors in different age categories, those that are 60 and above must still go and get vaccinated. We do know that the second dose is going to be administered as of Monday. It's exactly 42 days on Monday from the first initial doses that were administered on the 17th of May. This is going to be a huge logistical task for government to roll out a number of phases at the same time. But Annika, the vaccines are here. We know that there are going to be deliveries of Pfizer as well as Johnson & Johnson, and there are discussions with the regulator to possibly approve other vaccines. We know that's still in the pipeline, but the pressure is on, and we do need these vaccines to be administered as quickly as possible. And this is why government has decided to open up new sectors of the economy to get vaccinated, but also new age categories.
Heidi, you may not know this, but let me just throw it at you. Do you know if we are managing to utilize all the vaccines that we have available? Are we logistically able to make sure that we use the ones we have before they expire?
Yes, I do think we are able to use the ones we have before they expire, Annika, and I'll tell you why. If you just look at the 2 days that the education sector has been able to vaccinate, they are doing over 50,000 per day, and they are possibly able to do more. The ability is there for government to vaccinate as many people as possible. And being at vaccination sites almost every single day for the past 6 weeks, it does seem as though there is a bit of a lag when it comes to the registration and screening process. But as soon as vaccines are administered, it takes no longer than 5 minutes for a vaccine to be administered, to be in your arm, and then you 15 minutes in observation area. So the country does have the capacity to do this, and this is why there's so much more pressure on government to try and get this vaccine rolled out as quickly as possible. Having 80,000 vaccines administered per day is just not good enough, and this is why we are trying to put pressure on government to say you can do 100,000 a day, you can do 150,000 a day, and this is possibly why you're seeing more sectors open up. The goal was to have 5.5 million senior and elderly citizens vaccinated by the end of June. They're seeing those numbers very low at this stage, and this is why they're opening up more sectors, because there is more of a demand and a willingness for other categories to get this vaccine.
So Heidi, the over 60s, I then take it, are lagging. Is that vaccine reluctance, or is it just an inability for them to be able to actually physically register?
It's a number of things, Annika. I think there's a lot of skepticism given the setbacks the country has experienced with the COVID-19 vaccine. First, it was AstraZeneca, then Johnson & Johnson was put on hold for 2 weeks. Then there was possible contamination of Johnson & Johnson with the 2 million doses needing to be destroyed. And there's a lot of skepticism, but also given the fact that you are expecting senior and elderly citizens and people in remote and rural areas of this country to go onto an electronic vaccination data system to register for the vaccine. So there are a lot of hurdles that the elderly encounter before they actually get to a vaccination site, and this could possibly be contributed to this. It also could be contributed to the fact that we've seen such a high number of COVID-19 cases, particularly in Gauteng, where people are opting to rather stay away from vaccination sites until numbers drop. And we heard this from the acting health minister, Mmaloko Kubayi-Ngubeni, saying that it is a concerning issue and they are looking at the matter. We did pose a question, and hopefully we'll get an answer to that, as to what else is contributing to the low turnout of those 60 and above. The call is out there. You can walk into any public vaccination site and get your vaccine if you are 60 and above and you have not registered. So the call is out there to please go and get this vaccine, because the science and the evidence that is out there proves that the vaccine does work against severe COVID-19 issues.
Heidi Jacques, thank you so much for keeping us informed for the past 2 weeks from the epicenter of the coronavirus here in South Africa, Gauteng. That was eNCA reporter Heidi Jacques. Thanks.